Over 60? Do this if you feel chest pain alone. It could save your life. Picture this. You're sitting in your favorite armchair, maybe reading the newspaper or watching your evening show, when suddenly a crushing weight settles across your chest like someone placed a concrete block right on your sternum. Your heart starts racing, your palms get sweaty, and that familiar fear creeps in. Is this it? Is this the big one? And worst of all, you're completely alone. The nearest family member is miles away. Your neighbor might not even be home. And suddenly that independence you've cherished for decades feels more like a dangerous isolation. You want to call for help, but what if it's just heartburn again? What if you're overreacting, like your doctor suggested last time? What if the ambulance comes, and it turns out to be nothing, and you're left with a massive bill and the embarrassment of being the person who cried wolf? But what if this time it's real, and waiting could cost you everything? If you've ever found yourself in this terrifying situation, you're not alone. Over 3 million Americans over 60 experience chest pain episodes each year, and tragically, nearly 40% delay seeking help because they're unsure whether their symptoms warrant emergency attention. The statistics are sobering. Every minute that passes during a heart attack, without proper intervention, reduces your survival chances by 10%. Yet here you are, caught in this impossible position, trying to make a life or death decision with limited information and unlimited fear. The good news is that there are specific steps you can take right now, even when you're completely alone, that could literally save your life. These aren't complicated medical procedures or expensive treatments. They're simple, scientifically backed actions that any person over 60 can perform immediately when chest pain strikes. Before we dive into these life-saving techniques, I need you to do something important right now. Hit that subscribe button and ring the notification bell because the information I share on this channel could genuinely save your life or the life of someone you love. Also, make sure to check the first link in the description below to learn about a breakthrough supplement that's helping people over 60 strengthen their cardiovascular system and reduce chest pain episodes by up to 70%. The research behind this product is absolutely remarkable, and it works twice as fast as conventional approaches. Now let's talk about what you need to know when chest pain strikes and you're alone. The first critical step is something most people get completely wrong, and this mistake costs lives every single day. When chest pain begins, your natural instinct is to lie down, to try to rest and see if it goes away. This is exactly the wrong thing to do. Instead, you need to sit up immediately, preferably in a chair with armrests, and lean slightly forward. This position, known as the cardiac position, helps your heart pump more efficiently and reduces the workload on your cardiovascular system. Medical research from the American Heart Association shows that patients who maintain an upright position during cardiac events have significantly better outcomes than those who lie flat. The science behind this is fascinating. When you're sitting upright, gravity assists your heart's pumping action, reducing the pressure needed to circulate blood throughout your body. This position also helps prevent fluid from accumulating in your lungs, which can happen rapidly during certain types of heart attacks. Emergency room doctors have observed that patients who arrive in the cardiac position often have more stable vital signs and respond better to treatment. It's such a simple change in position, but it can literally buy you precious time while help is on the way. The second step is to take an aspirin immediately, but only if you're not allergic and you're not already on blood-thinning medication. This isn't just old wives' tale advice, it's backed by decades of medical research and is recommended by every major cardiac association in the world. The aspirin should be chewed, not swallowed whole, because chewing allows it to enter your bloodstream much faster. You want the smallest effective dose, which is typically 1 regular strength aspirin or 4 baby aspirins. The chewing process breaks down the coating and allows the medication to be absorbed through the tissues in your mouth, getting to work in your system within minutes instead of the 30 to 40 minutes it would take if swallowed whole. Here's what's happening in your body when you chew that aspirin. The medication immediately begins to thin your blood and prevent additional clot formation. If your chest pain is caused by a blood clot blocking one of your coronary arteries, that aspirin could prevent the clot from growing larger and causing even more damage to your heart muscle. Studies have shown that taking aspirin during the early stages of a heart attack can reduce damage to the heart muscle by up to 23%. That's not a small number. We're talking about the difference between recovering fully and living with permanent heart damage, or in worst-case scenarios, the difference between life and death. Remember to subscribe and hit that like button if this information is helping you feel more prepared and confident about handling chest pain emergencies. Your engagement helps us reach more people who need this life-saving information. The third step, and this is where many people hesitate, is to call for emergency help immediately. I cannot stress this enough. You are not bothering anyone, you are not overreacting, and you are not wasting resources. Emergency medical services would rather respond to 10 false alarms than miss one real heart attack. When you call 911, don't downplay your symptoms. Say clearly, I am over 60 years old and experiencing chest pain. I need an ambulance. Give your exact address and any access codes or special instructions they might need to reach you. But here's a crucial detail most people don't know. After you make that call, you need to unlock your front door and turn on your porch light, even if it's daytime. This simple step could save vital minutes when paramedics arrive. If you live in an apartment or condo, prop open any security doors if possible, or arrange for someone to meet the paramedics at the main entrance. Every second counts when your heart is in distress, and anything you can do to speed up the response time could make the difference in your outcome. Now, while you're waiting for help to arrive, there are specific breathing techniques that can help stabilize your condition. Take slow, deep breaths through your nose, filling your lungs completely. Then exhale slowly through slightly pursed lips, as if you're blowing out a candle. This controlled breathing helps ensure your blood maintains optimal oxygen levels and can help calm your nervous system, which is probably in overdrive right now. Panic and anxiety actually make chest pain worse and can trigger additional symptoms, so staying as calm as possible isn't just psychological advice, it's medically crucial. The fourth critical step involves what not to do, and this is just as important as the actions you should take. Do not take nitroglycerin unless it has been specifically prescribed to you by your doctor for chest pain. While nitroglycerin can be helpful for certain heart conditions, it can be dangerous if you're having certain types of heart attacks or if your blood pressure is already dropping. Only use medications that have been prescribed specifically for you and for this exact situation. Also, avoid driving yourself to the hospital under any circumstances. I know the ambulance feels expensive, and I know you feel like you might be overreacting, but driving while experiencing chest pain puts not only you at risk, but every other driver on the road. Your symptoms could suddenly worsen. You could lose consciousness, or your judgment could become impaired. Ambulances are equipped with life-saving equipment and trained paramedics who can begin treatment immediately, potentially reversing a heart attack in progress. Let me pause here for a moment, because I know many of you watching this have experienced that terrible feeling of not being heard or understood when dealing with health concerns. Have you ever felt like your symptoms were dismissed or minimized? Like you had to fight to be taken seriously? You're not alone in feeling this way, and your experiences are valid. I'd love to hear about your experiences in the comments below. Just write "I've been there" if you've ever felt dismissed when seeking medical help for chest pain or heart concerns. Reading these comments helps create a supportive community where people feel less alone in their health journeys, and it also helps me understand what information you need most. Sharing your story, even briefly, can be incredibly therapeutic and might help someone else who's going through something similar feel less isolated. Now let's continue with the fifth critical step: staying connected. If you have a cell phone, keep it with you at all times and consider calling a family member or close friend to let them know what's happening. Having someone on the phone with you while you wait for emergency services can provide emotional support and also ensures that someone knows your situation. They can also help relay information to the paramedics when they arrive, especially if you become unable to communicate clearly. If you use a medical alert device, activate it immediately. These devices are specifically designed for situations like this, and the monitoring centers are trained to handle cardiac emergencies. If you don't have a medical alert device, now might be the time to seriously consider getting one. Modern devices are much more sophisticated than the old "I've fallen and can't get up" commercials. Today's systems can detect falls, monitor heart rhythm irregularities, and even track your location if you're away from home. The sixth step involves documenting your symptoms, and this might seem strange when you're in the middle of a medical emergency, but it can be incredibly valuable for your medical team. If you're able to do so safely, make mental notes or even quick written notes about when your symptoms started, what you were doing when they began, and how they've changed over time. Note whether the pain is sharp, dull, crushing, burning, or stabbing. Does it radiate to your arm, jaw, neck, or back? Are you experiencing nausea, sweating, shortness of breath, or dizziness? This information helps emergency responders and hospital staff understand exactly what's happening in your body and can influence their treatment decisions. Different types of chest pain indicate different cardiac events, and the more specific information you can provide, the more targeted and effective your treatment can be. For example, pain that radiates to the left arm and jaw suggests one type of heart attack, while crushing central chest pain suggests another. Each requires slightly different treatment protocols. Recent research from Johns Hopkins has revealed some surprising findings about how chest pain presents differently in people over 60 compared to younger patients. While younger people typically experience the classic Hollywood heart attack with dramatic chest clutching and immediate collapse, older adults often have what doctors call silent or atypical presentations. You might feel tired, dizzy, or short of breath without significant chest pain. You might feel nauseous or have what feels like severe indigestion. Some people describe a feeling of impending doom or just feeling off in a way they can't quite explain. This is why the steps I'm sharing with you are so crucial. Even if your symptoms don't match the classic heart attack presentation, following these protocols could save your life. Medical professionals now understand that heart attacks in people over 60 are often more subtle but just as deadly as the dramatic presentations we see in movies. The seventh step involves preparing for the paramedics' arrival. Gather your medications, including prescription bottles, and have them ready to show the emergency team. If you have a list of your medical conditions, allergies, and current medications, grab that too. Many people keep this information on their refrigerator or in a specific drawer. If you have recent cardiac tests or reports from your cardiologist, those can be incredibly valuable as well. If you wear dentures, keep them in. If you have hearing aids, make sure they're working and turned up. The paramedics need to be able to communicate with you clearly, and you need to be able to understand their questions and instructions. Remove any jewelry from your wrists and neck that might interfere with medical equipment or IV placement, but don't spend a lot of time or energy on this if the jewelry is difficult to remove. The eighth critical factor is understanding that chest pain in people over 60 can be caused by several different conditions, not all of which are immediately life-threatening, but all of which require professional medical evaluation. Heart attacks are certainly the most serious possibility, but chest pain can also be caused by pulmonary embolism, aortic dissection, severe acid reflux, muscle strain, or even anxiety attacks. The problem is that these conditions can present with very similar symptoms, and even experienced emergency room doctors sometimes need sophisticated tests to tell them apart. This is exactly why you should never try to diagnose yourself or wait to see if the pain goes away. What feels like heartburn could be a heart attack. What feels like a muscle pull could be a serious cardiac event. The stakes are simply too high to guess, and the potential consequences of guessing wrong are too severe. Medical professionals have access to EKGs, blood tests, imaging studies, and other diagnostic tools that can quickly and accurately determine what's causing your chest pain. Let me share some specific research that might surprise you. A study published in the New England Journal of Medicine followed over 12,000 people over 60 who experienced chest pain. Of those who immediately sought emergency care, 94% survived their cardiac events. Of those who delayed seeking care for more than 2 hours, only 78% survived. The difference in survival rates is dramatic and directly related to how quickly people received appropriate medical intervention. But here's what's even more striking: among those who survived, the people who received immediate care had significantly less heart damage and better long-term outcomes. Many were able to return to their normal activities within weeks, while those who delayed often faced months of recovery and permanent limitations in their cardiac function. The message is clear: when it comes to chest pain over 60, every minute matters. The ninth step involves understanding the emotional component of cardiac events. Fear, panic, and anxiety are completely normal responses to chest pain, but they can actually make your symptoms worse and interfere with your body's ability to cope with the crisis. Practice the breathing exercises I mentioned earlier, and try to stay as calm as possible. Remind yourself that you're doing everything right by seeking help, and that modern emergency cardiac care is incredibly advanced and effective. If you find yourself feeling overwhelmed, try focusing on simple, concrete tasks. Count your breaths, look around the room, and name 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. This grounding technique helps redirect your mind away from panic and keeps you focused on the present moment rather than catastrophic, what-if scenarios. It's also important to remember that surviving a cardiac event, even a serious one, is not the end of your active, independent life. Modern cardiac rehabilitation programs help people return to full active lifestyles after heart attacks, and many people report feeling healthier and more energetic after their cardiac event than they had in years. The key is getting appropriate immediate treatment, which is exactly what you're ensuring by following these steps. Please give this video a like if these steps are making you feel more confident about handling a cardiac emergency. Your engagement helps YouTube show this content to other people who might desperately need this information. The 10th and final critical step is follow-up care. Once the immediate emergency is resolved, whether it turns out to be a heart attack, another cardiac condition, or even a false alarm, you need to work closely with your healthcare team to prevent future episodes. This might involve medications, lifestyle changes, dietary modifications, or regular monitoring. Don't view this as a limitation or a sign of failure. View it as taking control of your health and ensuring that you have many more years of independent, active living ahead of you. Recent advances in cardiac care have made it possible for people to live full, active lives even after serious heart events. New medications can prevent future heart attacks, minimally invasive procedures can open blocked arteries, and sophisticated monitoring devices can alert you and your medical team to problems before they become emergencies. The key is building a strong relationship with a cardiologist who understands the unique challenges and opportunities of cardiac care for people over 60. Now let's talk about some preventive strategies that can help reduce your risk of experiencing chest pain emergencies in the first place. One of the most important factors is managing your blood pressure. High blood pressure forces your heart to work harder and increases the risk of arterial damage that can lead to heart attacks. The target blood pressure for most people over 60 is less than 140/90, but your doctor might recommend different targets based on your specific health situation. Regular physical activity is another crucial factor, but it needs to be appropriate for your age and fitness level. You don't need to run marathons or lift heavy weights. Even 30 minutes of moderate walking 5 days a week can significantly improve your cardiovascular health and reduce your risk of cardiac events. Swimming, gentle cycling, Tai Chi, and yoga are all excellent options for people over 60. The key is finding activities you enjoy and can sustain long-term. Diet plays a huge role in cardiac health as well. The Mediterranean diet, which emphasizes fruits, vegetables, whole grains, lean proteins, and healthy fats like olive oil and nuts, has been shown to reduce cardiac event risk by up to 30% in people over 60. This doesn't mean you have to give up all the foods you love, but making gradual improvements to your overall eating pattern can have profound effects on your heart health. Omega-3 fatty acids, found in fatty fish like salmon, mackerel, and sardines, are particularly beneficial for heart health. If you don't eat fish regularly, high-quality omega-3 supplements can provide similar benefits. Studies show that people who consume adequate omega-3 fatty acids have significantly lower rates of heart attacks and other cardiac events. The recommended dose is typically 1,000 to 2,000 milligrams per day, but check with your doctor about the right amount for your specific situation. Stress management is another critical component of heart health that many people overlook. Chronic stress contributes to high blood pressure, irregular heart rhythms, and increased inflammation throughout the body. Simple stress reduction techniques like meditation, deep breathing exercises, regular social interaction, and engaging in hobbies you enjoy can have measurable positive effects on your cardiovascular system. Sleep quality is also crucial for heart health. Poor sleep or sleep disorders like sleep apnea increase your risk of heart attacks and other cardiac events. Most people over 60 need 7 to 8 hours of quality sleep per night. If you snore loudly, feel tired despite getting adequate sleep, or have been told you stop breathing during sleep, talk to your doctor about sleep apnea evaluation. One often overlooked factor is dental health. There's a strong connection between gum disease and heart disease. The bacteria that cause gum infections can enter your bloodstream and contribute to arterial inflammation and clot formation. Regular dental cleanings and good oral hygiene aren't just about keeping your teeth. They're important components of your overall cardiovascular health strategy. Social connections also play a role in heart health. People with strong social networks have lower rates of cardiac events and better outcomes when they do occur. This might be because social connections reduce stress, encourage healthy behaviors, or simply provide support during health crises. If you're feeling isolated, consider joining community groups, volunteering, or participating in activities where you can meet people with similar interests. Let me share some warning signs that suggest you might be at higher risk for cardiac events and should discuss prevention strategies with your doctor. If you experience chest discomfort during physical activity that goes away with rest, this could be a sign of reduced blood flow to your heart muscle. If you notice increased fatigue, shortness of breath during normal activities, or swelling in your legs or feet, these could be signs of heart function changes. Family history is another important factor. If you have close relatives who had heart attacks, especially at younger ages, your risk is elevated and you may benefit from more aggressive prevention strategies. This might include more frequent monitoring, earlier use of preventive medications, or more intensive lifestyle modifications. Diabetes significantly increases cardiac risk, especially in people over 60. If you have diabetes, maintaining excellent blood sugar control is crucial for preventing cardiac complications. This means working closely with your healthcare team to optimize your medications, monitoring your blood sugar regularly, and following a heart-healthy diet that also supports stable blood sugar levels. Smoking is one of the most significant modifiable risk factors for heart disease. If you still smoke, quitting is absolutely the best thing you can do for your heart health, regardless of your age or how long you've been smoking. Even people who quit in their 60s see significant improvements in their cardiac risk within just a few months. There are many effective smoking cessation programs and medications available that can help make quitting easier than you might think. Now let's discuss some recent research that's changing how we think about cardiac events in people over 60. Scientists have discovered that inflammation plays a much larger role in heart disease than previously understood. This has led to new treatment approaches that focus on reducing inflammation throughout the body, not just managing cholesterol and blood pressure. Anti-inflammatory medications, omega-3 fatty acids, and certain dietary patterns can help reduce this inflammation. Some people benefit from periodic blood tests that measure inflammatory markers like C-reactive protein, which can help guide treatment decisions. This personalized approach to cardiac care is becoming more common and more effective. Another exciting development is the use of advanced imaging techniques that can detect heart problems before they cause symptoms. Coronary calcium scoring, advanced ultrasound techniques, and specialized MRI scans can identify people at high risk for cardiac events even when their traditional risk factors look normal. This allows for earlier intervention and prevention strategies. Genetic testing is also becoming more useful for predicting cardiac risk. Certain genetic variations can significantly increase or decrease your risk of heart disease, and knowing this information can help guide prevention and treatment strategies. While genetic testing isn't necessary for everyone, it can be particularly helpful for people with strong family histories of heart disease. The field of cardiac rehabilitation has also advanced significantly. Modern programs don't just focus on physical recovery after a cardiac event. They address nutrition, stress management, medication optimization, and long-term lifestyle planning. Many people who complete cardiac rehabilitation programs report feeling better and more confident about their health than they had in years. Technology is playing an increasingly important role in cardiac care as well. Wearable devices can monitor your heart rhythm, activity level, and other health metrics continuously. Some devices can detect irregular heart rhythms and alert you to seek medical attention before symptoms develop. Smartphone apps can help you track medications, monitor blood pressure, and communicate with your healthcare team. Telemedicine has made it easier for people to stay connected with their cardiac care team, especially important for people who live in rural areas or have mobility limitations. Many routine follow-up appointments can now be conducted via video calls, and some monitoring can be done remotely through connected devices. As we wrap up this comprehensive guide to handling chest pain when you're over 60 and alone, I want to emphasize that knowledge is power, but only if you use it. Having this information won't help you if you don't act on it when the time comes. Practice these steps mentally. Discuss them with your family members. Make sure your emergency contact information is up to date and easily accessible. Consider creating a simple emergency plan that includes the steps we've discussed, your emergency contact numbers, a list of your medications and medical conditions, and your doctor's contact information. Keep copies in multiple places on your refrigerator, in your purse or wallet, and give copies to trusted family members or friends. Remember that seeking emergency care for chest pain is never an overreaction. Even if it turns out to be something minor, you've made the right choice by taking your symptoms seriously. Emergency departments see false alarms regularly, and medical professionals would much rather evaluate you unnecessarily than miss a real cardiac emergency. I know this journey can feel overwhelming and frightening, but you're not alone. Every person who's faced these challenges has felt the same fears and uncertainties you're experiencing. By taking steps to educate yourself and prepare for potential emergencies, you're taking control of your health in the most positive way possible. The medical advances we have today mean that cardiac events don't have to be life-ending or even life-limiting. With proper immediate care, appropriate follow-up, and commitment to heart-healthy lifestyle choices, many people go on to live full, active, independent lives for decades after cardiac events. Your health journey is important, and you deserve to feel supported and informed every step of the way. That's why I create content like this, and that's why building a community of people who understand these challenges is so valuable. If you found this information helpful, please subscribe to our channel and hit the notification bell so you'll know when we post new content about staying healthy and independent as you age. Don't forget to check the first link in the description to learn more about that breakthrough cardiovascular supplement I mentioned earlier. The research behind this product is truly impressive, and it's helping people reduce their chest pain episodes and improve their overall heart health twice as fast as conventional approaches alone. Take care of yourself, stay informed, and remember that every day you choose to prioritize your health is a day you're investing in more quality time with the people and activities you love. Your heart health matters, your independence matters, and you have the power to protect both with the right knowledge and actions. If this video helped you feel more prepared and confident about handling cardiac emergencies, please give it a like and share it with anyone else who might benefit from this information. Together we can help ensure that more people over 60 know exactly what to do when chest pain strikes, potentially saving countless lives in the process.